responses later. And as a reminder, this will be recorded. It may be shared later for those who missed it. We've added some links so that you can find additional information after this webinar on the COVID-19 pages. There's a transmittal regarding the executive order and the healthcare rule and what is expected from all of the programs that fall under that rule, which is our group homes and adult foster homes. There is the healthcare rule FAQ, as well as director's message, and an example of an agreement letter for group home providers. All of these links you can find in the chat if you'd like more information about them. Next slide. As a reminder, there is an OHA rule, and the rule reference is cited here. This is the rule that requires all healthcare providers to be vaccinated or have an approved exception as of 11:59 on October 18th. And the rule again applies to group homes and adult foster homes. Thanks, Acacia. As a result of the mandate, we knew that many of you would experience additional employee loss. It's been a hard year and a half, and even before that, there was a staffing crisis in Oregon. And so we have put into place a process for you all to identify your support needs, for us to connect with you and find out how to help with the staff and how to deploy the temporary staff. We are using a survey that you receive once a week on Wednesdays. It's the same link every week. You can update it as often as you need to. You don't have to wait for us to send a new one each week if something changes for you. The contracts will be, and for staff will be initially for 30 days with the option to extend it afterwards if you need to. We don't intend to take employees away from you after those 30 days if you need them to remain. The contract that we have with OHA, or that OHA has, will expire on December 31st, because this is truly a temporary staff support related to the mandate. We do have some expectations of providers who receive these staff to train them to work in your homes. You can still follow the ODDS reopening guidance around the training requirements. So it's still the reduced number of core competencies that are required for the staff to begin working. We will be assigning staff based on what you have told us in your survey, as well as we have a small little team of support calling you to get additional information about what you really need and the specialty or the experience or the types of certificates that you need for people to work in your home, such as CNAs or RNs. Once staff are identified for a specific location, we will be working with the contractors to get employees to your site and to your home. Next slide. We had sent out through a director's message a draft of the agreement letter that you will need to sign once you've had a contact or a call from one of the ODDS employees working on this team. We will send you an agreement letter that needs to be returned before staff can come to your home. There is an expectation that there will be a $25 copay per hour of support provided. That rate will increase after the 30 days if you need to keep them. So in terms of training, what we are doing is having these employees complete as much of the online training through Workday before they come even to your city if they have to move from a different location. They are, right now we have several staff that are working to help them with that, to get the core competencies completed. We are also coordinating virtual OIS training that will be required for them to complete also before they come to your homes. The contractors are doing criminal history check, but they are not doing one portion of a requirement for people to work in the homes, and that is the Oregon abuse check. And so as staff are assigned to your home, there will be a requirement for your qualified entity designee or your QED to process a background check, but you still can have them work under preliminary approval with supervision, same as you are doing now as you're onboarding your own staff. The training and criminal history check expectations mirror what's in the reopening guides. We are requiring that staff work a minimum of 30 hours, but not more than 40 because of the way these contracts are written. Can you go to the next slide, please? There's some additional contract information and agreements. We want to ensure that people are safe in your homes and that the employees coming in, the contracted staff that are coming in are respected and treated appropriately. So there is some expectation that providers and your agency will not condone or tolerate any type of prejudicial remarks or actions, slurs, or jokes. We don't know who is coming, where they are coming from, or their background and experience personally. We know the professional experience, but not their personal experience. So we just ask that there is that recognition that they might be coming into an area that they are not used to living in, such as rural or coming from rural and working in a city. We will also require weekly reports back to us on a spreadsheet that we will provide to you, letting us know how many hours each staff worked. That's how we are going to be calculating the copay, as well as how we are working with the contractor around invoices. If you no longer need a staff for at least 30 hours, then you will let us know that as well, and we will adjust your contract as appropriate. Invoicing. Heather, are you on?
Yes, I am here.
Can you talk about invoicing?
Sure. So invoicing will be handled through what we call an accounts receivable, and it will not go through Express. So we will not be taking any money back through Express through liabilities. What will happen is an email will be sent to the provider from our Office of Financial Services within about 90 days after the staffing assignment has ended. And that will include all of the instructions on how to resubmit the payment. And then it's expected that the provider will resubmit the payment within 30 days of receiving that accounts receivable request.
Thanks, Heather.
Yep.
Next slide. And now I'm going to ask Sierra to talk about her experience and the SACU's experience as they onboarded temporary staff. Sierra?
Good morning. I'm Sierra Rawson, Director for Stabilization and Crisis Unit, SACU. We've been onboarding contracted workers since about October 6th. So I just was going to speak to what has worked for us. We had put together quite a bit of virtual training due to COVID, and so we were able to utilize that training for the workers. We modified our new employee orientation, which is usually several weeks, down to just kind of the basics, and then we're able to do training in the houses as well. We created a training schedule with deployment information for each person. That was really helpful for them to know exactly what location they were going to for training and where they were going to be deployed, because while they might be training in Salem, they may be working in Eugene. We found out pretty quickly that we needed a point person at our central office for questions. So some of the people that were coming in weren't really sure what we do. And even though we gave a lot of information to the contractor, some of it didn't get followed through or passed down. And so having a welcome person here at our central location just to talk about SACU, answer any questions was really helpful. And then I emailed a welcome letter to each person who came through. What also was working was 2 times a week, we're meeting with our managers and doing webinars and Q&A just to specifically talk about the contracted workers and work through any issues or just hear the kudos as well. And our nurse manager noted that a lot of the folks coming in are CNAs or MAs or RNs. And so explaining to them that this is more of a home health setting was helpful to them because they weren't 100% sure what group home meant. It's a little bit different. A lot of people are coming from Kentucky or Florida, Alabama, Colorado. So just explaining to them what the Oregon IDD system is was pretty important. So next slide. What wasn't working or we're working on, contracted workers thought they were going into a medical setting. So we learned pretty quickly that we needed to meet with the contractor. So we're also doing 2 times a week meetings with the contractor. Just to say like, hey, this is where we need assistance with making sure communication is getting across, because when we had folks showing up, they were wearing scrubs and we were asking them to please wear street clothes, and they thought they were going into a medical setting. What didn't work was the timesheet process and approvals. So that the first week or 2 was kind of bumpy, but I think we have a process in place that works for us now where they're keeping timesheets at the houses and managers are signing off, where before they were keeping them with them and they weren't always seeing a manager. We've scheduled folks for 12-hour shifts. And so if they were coming in at 6 p.m., there may not be a manager there at that time. So it was really helpful to keep the timesheets in the house and just have a book specific for those. And then those get sent in once a week so they can get paid. We had some transportation issues and some communication from contractor to the workers. Everybody that came in for us, they're staying in hotels and they're transported by 1 van in each area. And so sometimes people were showing up at a wrong location or they didn't show up because transport didn't show up to get them. And so we have been working through that and trying to be really communicative. Also, we recently had an outbreak at one of the homes. And so just keeping in contact with transportation to make sure that they're not putting all of a group of Salem folks in the same van, because we need to separate folks who are working the outbreak. And then the workers demobilizing. So that has occurred where workers just, for whatever reason, decided this wasn't for them, or they had a family emergency, or they got sick and they've demobilized. And sometimes it takes a day or 2 for the contractor to let us know. Obviously, we know pretty quickly when somebody doesn't show up. And so just communicating where workers are and the demobilization is really important. And we've got this large spreadsheet and we've color coded it to who's coming, who's going, and where we think people are, and then double checking on that each day with the managers. And then what we're working on is the training process. It was a lot of people to bring in a short amount of time. And so it was all hands on deck for training. And they start training immediately. And sometimes they only have about 24 hours notice before they get on a plane. And we have 24 hours notice before they show up. And so just having a really strong training plan and being really flexible with that. We're working on that. And then tracking the demobilized workers. So I think we've got a spreadsheet in place within the last few days that we're just keeping up to date in real time. Everybody has access to it. We can see it. We know exactly where people are going and when they go. And then continued communication to our permanent employees has been really important, because there's obviously a lot of rumors about why are folks here, what are they doing here? And so continued communication about what they can and can't do. And our workers can't drive our vehicles, so we mentioned that, and there's certain things under our bargaining agreement that's specific to our employees, and they wanted to know, are we doing that with this group of folks? And I said, no. So just that continued communication with employees and giving them a two-way communication process is really helpful. And that's it for me.
Thank you, Sierra. So now we will go into our frequent, or calling them frequently asked questions, but they've just come up once so far, and we will be posting these as well later. Angela,
Yeah.
are you?
I am here. Yes, so I'm going to ask some of these questions that we received, and then Shayla is going to provide the answer. So first question, what if a provider needs help but has not yet been contacted by ODDS?
All of our outreach is based on the survey that each provider is completing each week. As providers need help, they should be going back to that survey link that I mentioned. You can go back to last week's or the week before, that's all the same link, and update it as needed. That is how we are identifying which homes have either become unstable or maybe they're stabilizing, and we are contacting you with based on that data. We are about a couple days behind. Once you've gone into the survey and identified that you need help, we are about a couple days behind right now contacting people, but we will contact you.
Okay. How will the contracted staff receive OIS training? Can the OIS contractor provide additional classes? And will they receive individual focused training as well?
We are working with our OIS contractor to stand up virtual OIS training next week, is what we are hoping. We're in the middle of coordinating that. That training will not include the physical portion. The physical portion will need to be completed by providers who are accepting these staff if the home requires OIS to be part of the training for that home. If your home needs the individual focused trained staff, then you will need to be providing that as well.
Will ODDS allow for very reduced training requirements for contracted staff?
The training requirements are the same as in the reopening guides, which identify the reduced training expectations for the core competencies. And we are expecting the contracted staff to meet those minimum requirements. And as I mentioned before, we're doing as much as we can prior to sending you these employees, as much as we can virtually with them as possible.
Can providers who invest in training of the additional contracted staff keep them throughout the staffing crisis?
The contracts will be for 30 days. And then if you need to continue with the staff, then yes, they can be extended. Right now, our contracts are only through December 31st, however.
What if a provider needs help? Oh, we already read that one. How are supervisory issues addressed? What if a worker is not a good fit or exhibits serious performance concerns?
Let us know. If it's not working, then you would contact our office, and that we have an email set up. You will be getting emails from the odds.staffing support email. That's how you will let us know. And then if we need to find additional staff to come to your home or to replace somebody who has been returned, that we would work with you at that point.
Can these workers work anywhere, i.e. with people who are sometimes physically aggressive?
This will depend again on the support needs of your home and what the training with each of these staff, how high of a level of OIS training they have completed. We recommend that you ensure staff working with people with behavior challenges have received that individual focus if necessary. And if it's possible, potentially having your own staff be moved to different homes so that these staff can support people who don't have that level of need if they aren't trained.
Does the provider need to pay for any hotel or travel costs for these contracted staff?
No, our contractor is responsible for hotel costs as well as coordinating training, or excuse me, travel.
Can the contracted staff get training on things like CPR, core competencies, tier 1, tier 2 OIS by someone other than the providers?
ODDS is coordinating with the contractor to do as much as they can through within the training requirements in the reopening guides. So some of this will be with the provider and some we are doing ahead of time. And I'm going to go offline a little bit and answer someone's question in the chat that is related to this. The agreement that you're signing, it says that you must ensure all employees have had the training, which means that you would need to just validate that they've completed their workday training and the virtual component of OIS. If they haven't, then it would be the responsibility of your agency to have them complete those trainings. But it is that you just need to ensure that they have had all of the right training and criminal history checks.
If providers are stable currently but become unstable later, what's the best way to get back into contact with ODDS to ask for extra support?
Through the staffing link, the survey. That's how you let us know you need more help.
What type of experience do these contracted staff have? Have they worked with individuals with IDD or in group home settings before?
They are coming to us with a variety of experience. The position description meets the minimum expectations for DSPs. And like Sierra mentioned, they come with a variety of background, skills, training, experience, certificates. So we don't know specifically until we get the list, but they do have some variety of experience.
Why can't the additional Oregon background check be completed before they come to the provider agency?
If the employees are outside of Oregon, they cannot, the contractor cannot do the Oregon check. So an Oregon provider must submit the background check through our background check unit, the state's background check unit for that requirement. I promise you, Lilia Tenenty has done everything she could to get that check completed before they get here, but it wasn't possible. And that's the one piece that providers will need to submit through from their QED into the background check unit with the state.
Who is validating that the contracted staff are fully vaccinated?
The contract requires that the contractor confirms the vaccination status.
I think that's all the questions we have. Here's our general email box if folks have questions. I think we have some questions in the chat. I don't know if we want to go to that next.
Yes. Angela, do you want to read those or do you want me to?
I can do it. I've been monitoring it. Some of these we've already addressed, so I will skip over some of those. But let's see. Okay, first question. Will the agreement be changed to reflect the training and checks as described in this presentation before providers are asked to sign it?
I mentioned that briefly. It's that you need to ensure that staff have completed all the training, and that would include looking at a certificate from Workday showing that they've done the core competencies through Workday, or that we have a list of them on our OIS, the virtual OIS training.
Another question. If we need a community nurse, but not in DSP work, can we access this 30-hour per week through this contract? The nursing support is very difficult to find right now.
This contract is for staff to support group homes and foster care homes. That might be a separate conversation that we would have to look at whether or not that meets the contract expectations.
how will they communicate with us what training has been completed with the contractor prior to start, i.e. FA, CPR, tier 1, tier 2, et cetera?
We are expecting that they come with proof, printout, or we will provide it ourselves. There is somebody within the emergency management unit working with Emily Terry, who's on my team. They will be looking in Workday to pull up certificates. So we will be expecting that they come with some validation.
The question right after that is essentially the same question. So, so someone wanting clarification on why ODDS can't run the background check instead of providers. Another question around that.
I don't know what more I can say other than we worked, and I think Lilia talked until she was blue in the face to try and get our contractors to be able to do that. But because of state laws, only providers in Oregon can do the Oregon abuse check. So if they're coming from out of Oregon, they do have to be here and be run by an Oregon employer.
I
Do we
can add to that if you want.
Yeah, sure. You've done all the talking on this one.
Yeah, just real quickly, the issue is around the QED, the status of who the QED is, and we have official, what's the word, variant from BCU that was signed off on by DHS leadership on allowing what we've been doing, which is the preliminary hire status, and that's what we're really going to look to providers to do. But it is what it is, and this is where it's landed. It's the best we could get at this point, given all of the circumstances that Shayla has already explained.
Okay, so we have a couple more questions. Do we have to provide a staffing schedule to the contractor prior to accepting staff, or is the staffing schedule assigned when the staff arrives?
That is a great question. We are expecting you to coordinate staffing. The contractor has asked us for specific staff schedules, and we are giving them a variety, including there's 8-hour shifts, 10-hour shifts, 12-hour shifts, graveyard, there's everything. So then we are expecting that you would assign their specific schedules. There may need to be some discussion and adjustments based on your current employees and what those schedules are. But we are asking that you do the scheduling with the staff once you know the names, and we give you the contact information for them.
Okay, we have another question regarding transportation in rural areas. Will there be rental cars available?
I do not know how they are coordinating it, but they have assured us that they are getting the employee from wherever they are staying, their hotel, to your work site.
Right, so the contractor is in charge of that part. Yeah.
Yeah. Thank you.
And another question, is working over 40 hours strictly prohibited based on the contract?
So it's possible. We've got 3 contracts with different contractors, and one contract will permit working more than 40 hours. So it will depend on which employees you are getting, and I can't tell you how that's going to work right now. If the one contract, I believe, is up to 60 hours, and we only have a specific number of employees coming from that contract. It's very small. The other contracts do have a 40-hour restriction. We can take it back and see how flexible that is, but I suspect it will be a strict 40 hours.
Any more questions? So when one home doesn't need that staff person, can they be moved to one of our other unstable homes?
That is a conversation you will need to have with us once you don't need that staff at that site. If it's possible, but we can't commit to that. So let us know and we can talk through that.
What is the wage expected to increase to after 30 days?
Oh, Lilia.
Yeah, and I'm not going to use the word wage because it's not wage. It's kind of a copay for the full hourly rate that we're paying the contractors. We haven't nailed that down yet. The intent of this entire contract, all the contracts and the work we're doing is be short-term while providers are able to get the staff that you have fully vaccinated or hire new staff that have become fully vaccinated. So the intent of the increased amount after 30 days is to really just reinforce the idea that this is a short-term resource, but we haven't specifically identified what that will be. I think for the most part right now, we're just seeing what the interest is and how we can get these staff going and how it works. And then we'll focus on that in, a few weeks from now when it becomes evident that we might need to extend some contracts.
And then we have a question about when will they hear if they are assigned help?
Right now, we have about 70 people who are going through the workday process. And then next week, we are hoping the OAS virtual training will occur. As soon as we have employees who have completed those expectations, or at a minimum, the workday training, if you want to do the full OIS training with people, we might have that discussion next week. But then once people have completed those training requirements, my staff will reach out to you. Emily Terry is leading this effort from our team, and we've got 4 other people who are working with her. We will call you once we have employees' names and contact information. And from there, you will be able to communicate with them. But it won't be before the middle or end of next week at the soonest. And I will say that's for those of you who have already heard from us. We're still making calls today and I believe Monday to get additional information from those providers who've identified that they are unstable. If you've heard from us already, that's great. We're sending you agreement letters and filing those away and identifying that you've done everything you need to do so far to let us know you need help. And then as soon as we've got staff available, we will be contacting you. And I want to just say thank you. I know that we've kept saying next week we think we'll have staff, next week we think we have staff. And I think that's probably hard to hear. So just thank you for your patience as we work through this.
Don't see any other questions in the chat right now. We'll just give it a second in case folks thought of 1 or 2 more questions. We've put those links in the chat box that have been in the presentation, and this presentation is being recorded and will be posted on the ODDS COVID webpage, most likely. Okay, we have another question. What if a provider signs the agreement now while in need, and by the time help arrives, we don't need the help anymore?
I will say amazing, wonderful, and then you just let us know. So if you've signed an agreement, once we have staff, we will be contacting you. And at that point, you can let us know that you don't need the help any longer, or you can also go into the survey and identify that you are now stable. That's another way you can let us know.
No other questions coming in right now. Oh, I spoke too soon. If we have OIS classes available, how can we communicate that to get staff sooner?
That is fantastic. How about you email the odds.questions? If you can email us at that link, we will grab your contact information and get in touch with you.
Okay, I don't see any other questions.
All right. Thank you all for showing up early on a Friday morning. Have a good day. Thank you.
Thanks, everyone. We'll go ahead and end the webinar now. Hope you have a wonderful Friday.